Right. Well, thank you everybody for joining us for this Wednesday, May 4th meeting of the City of Charleston Health and Wellness Advisory Meeting on a beautiful May Wednesday. And for those Star Wars fans, May the 4th be with you. Before we jump completely in, some of you may have heard us talking. I want to thank Carolyn Murray for an awesome podcast she did Sunday with Police Chief Luther Reynolds. I hope that you'll look at it. Some of you may see it in the chat. I left a link there, but you know, just an incredible story of a miraculous recovery, healing, is you know, his positive attitude, his faith, and everything. And Carolyn did an amazing job of pulling that out. So I hope you'll take time to look at that. I think that the members of this committee will appreciate that. So and we'll enjoy that podcast. So Carolyn, thank you for doing that. We appreciate
Kevin,
it.
Thank you very much. I am really grateful and didn't expect to hear that this morning, but I appreciate it. And I do invite everyone and encourage you to listen. It's an amazing story. It really doesn't matter where you are in your life. There are takeaways from the interview. That interview had nothing to do with me. It really is indicative of the spirit of the chief and the spirit of this community. So thank you very much for those kind words, Kevin. And I do invite all of you to listen. Thanks.
All right, thank you very much. Okay, and we'll move on to our minutes. And that packet of minutes from April 6th, Paul also included a lot of information on the Low Country Mental Health Conference and how you can attend in person or virtually. Those dates are July 27th through 29th. And of course, it's going to be down at the Gilliard over on Calhoun Street. So hope you'll take a chance to look at that. And if we would, I need to get an approval of the minutes from April 6th. If you had a chance to look at that, can I get a motion to approve those minutes, please?
So moved.
Can I get a second on that?
Second.
Okay, thank you, Mr. Mayor. Thank you, Susan Johnson. All in favor, please say aye.
Aye.
Any opposed? Okay, so those minutes are approved, and so we'll move on to our next agenda item. I think Paul Wieters and Joey Kern are going to kind of give a team effort and go through a presentation addressing disparities in life expectancy. So if you would, guys, I'll let you take it from here.
All right, just a second. You'll see the I'm seeing the different. So Joey put together this presentation back, I think, in February, and I've added to it with just some numbers that the mayor has continually asked us for. What's going to be a baseline of what we're looking at? And what I had is I had an intern last semester that was a student at the, he was working on his nurse practitioner doctrine, and his name is Tyler Ramirez. He's working at Roper St. Francis as a nurse currently. He's from the San Diego area, but we worked on looking at all the disparities listed on the city health dashboard, and from there pulled together those numbers. What Joey had done in the prior times with this presentation is he had identified, I'm gonna, somehow I got my sequence out here. He had identified four of the lower areas with life expectancy in the city of Charleston. That's the 29405, the area above Mount Pleasant Street, the 29403 is the area around the east side, the 29403 area, number 15 is around the just south of Mount Pleasant Street down to right around Hampton Park. And then he looked over in West Ashley and he pulled out the area around Ardmore from the area right off of Highway 17 behind Bessinger's Barbecue toward Whopper Road is the Ardmore area. And those were the 4 lowest age groups or life expectancies in our community. He also then went and pulled out the top 3 areas that were the highest in our areas, and they were all in West Ashley. One was around the North Bridge area, one was around Moreland area, and the other one was out in Cane Bay, not Cane Bay, but in
Carolina Bay.
Carolina Bay, I'm sorry, got lost on that one. And so what we did is we went through our map looking at those 3 areas and those 4 areas for the low impact, for the low life expectancy, and compared them with the ones with the for the higher life areas. And we broke it down into the areas that when we were doing the city plan, we focused on a couple of areas. So we just sort of compared those things together. So the first one that I'm gonna pull for you, and somehow I don't know where my map disappeared earlier. Let me get back to slide 2 if I can. Yeah, I'm missing slide 2. But, so what we did, when you look at the maps, and when I do these slides, when you look at the maps are going to change every time I change a screen. And so when each map's a little bit different. In the rate resilience and equity, that considers the impacts of flooding, high water, natural hazards on individuals, communities, institutions, business, economic development, public infrastructure and facilities, and public health and safety. So we know to improve access to healthy foods, we have to reduce the food deserts and promote a healthier lifestyle. Collaboration will be in many stakeholders in our community to make that all happen, to help build local markets or other ways to get into our community. But if we take these areas that we look right now, the limited access to the healthy foods, thinking about those first 4 zip codes that you see, 29405, number 44, number 9, number 2702, number 15, the top 3, 29405, 44, and 9, it's 95.8 for those that have limited access to healthy foods in that community. 63 as we come down to the east side, and then in West Ashley, Ardmore in the area is considered 81.5 as a limited access to healthy foods. And the same thing at the bottom, if you look at racial and ethnic diversity in our community, you'll see those 4 areas again are our high areas on it all. The next one we looked under equity from the city transportation standpoint. The map that you're seeing shows the income equality issue, and you can see again on the map how it changed into the areas that are most affected. And you'll see the 4 areas that we're talking about, how you'll see 29405 popping up as being in that dark area a lot of time, again in Ardmore. And this equity, if we go, the transportation plan defines equity as the intentional elimination of disparities disproportionately impacting marginalized people in the community. It will take proactive steps in embracing the complexity of experience, elevating the potency of inclusion, exposing the creativity in every community, demanding honesty and calling out racism and oppression, both overt and systematic, and striving to co-empower residents to implement goals. Equity happens when no one else is blocked from reaching their full potential due to race, gender, sex, disability, economic position, or other socioeconomic things. So one of the areas that we could work on here is if we looked at how we could shift away from vehicular traffic to other modes to help the city reach its net zero goals, and work on our health and all policies just by encouraging more examples like that. The next slide talks about economic development, a little bit about how we limit the access to healthy foods again. And on this one, I've got one on the value on this slide changed on me, but if we looked at poverty in our community, you can see that poverty again focus on the 29405 area, down in the east side area, and it's not as bad in the 29407, but it does have an impact on it all. That's actually the slide for the children in poverty, but you can see those numbers that are right there that are popping up. Diabetes is in our community. It's one that we've got under control in some areas, but in the lowest life expectancy compared to the highest, you can see the big difference there, from the under 10% to over 20% up in the neck area. And that's the area that we have to pay really attention to, that there's a direct correlation between limited access to healthy foods in neighborhoods with low life expectancy. These factors place residents at increased risk for heart disease, diabetes, breast cancer, and there's that association is directly there with children. And next month, Nick is going to talk to us a little bit about the food deserts and what Low Country Food Bank is doing. So I think it's going to be good for us listening more and more to figure out what partnerships are going to be out there to help us with addressing that. Housing is one of the areas that will contributes to a lower life expectancy. We know that the area codes 29403 and 405 have the most residents with the lower high school graduation rates, and unemployment and poor housing. So those are the areas that we have to keep a focus on to make sure that people aren't living in unsafe conditions that compound their current health, such as heart disease, diabetes, and cancer. And we also know housing costs are a factor when where residents can move. So all of those items, we've got good plans throughout the city working on them, but there's ones we're going to have to hold our foot to the pedal to make sure we make it move on it. City value for housing with potential lead risk is something we always look at. I thought it was interesting to look at those numbers inside the city. Still looking at 29405 and 403 is having some high rates of lead poisoning that DHEC we know will be helping us continue to keep a focus on. And then the one that was worrying me was this, in the land use, as we look at land use policies, is what is happening with obesity in our community. If you look at the three healthiest groups, they're all under the norm in our community. But there again, you look right at the four of the communities that we're have identified as lower health. Those numbers are popping up. We need to encourage walkable, efficient neighborhood patterns that support connectivity, mobility, and health through development, regulation, incentives. Continue to work collaboratively with COG and North Charleston to provide transit-oriented developments along Low Country rapid transit. And we've got to pay attention to what we're doing with our children in those areas. How are we moving them forward in not only our communities, but through the school system too, to encourage that. The city value for high blood pressure in Charleston, you can look at that, look at again, the numbers that 29405 number just pops out, 29407 in West Ashley. Those areas are is right there. We see that association between obesity, high blood pressure, and physical inactivity in all four of our low life expectancy neighborhoods. These factors reciprocally influence each other and worsen health outcomes for residents. With the help of our city departments and putting policy, maybe we can increase what we're doing with sidewalks, the development of urban parks. It's the best thing we can do is educate our residents to have some physical activity each day to increase their life expectancy. We know Parks and Recreation has just done their master plan, and I think we all just need to look forward to how we can help try to move the needle in those areas. As we look at natural resources, if you come down, you can see our park access. Probably 29405 has most limited areas for green space up there, but areas that we definitely have to pay attention to. I will say the 29414, that area number 56, that's Carolina Bay Park area, Bay Area, Carolina Bay Area. And those areas, I think when these numbers came in, Carolina was just under development. And so you can see a lot of lower numbers out there, or numbers that maybe pop out, but I think most of that is through all the development. Things are popping to a positive side out there. As we look at resiliency and equity, we need to continue to promote urban agriculture and community gardens, especially in areas qualifying as food deserts. Again, that healthy foods is going to keep showing that one, but that's the one where we really have got to figure out how we move the needle to help make that happen. Resiliency and equity, we have to look at uninsured individuals based on communities with lowest life expectancy. You see that area again, that's up 29405, 403 areas are going to need some help. We know income equity and uninsured individuals are associated with the 4 unhealthiest zip codes. Poverty affects whether or not an individual can obtain health insurance. The lack of health insurance is associated with higher care costs, decreased quality of life, increased disease prevalence, and poor health outcomes. Each factor reciprocally influences the other. So it's one that we just have to keep figuring out who the players are in our community that we can introduce our resources into. Transportation, according to the city's health dashboard, air population effects impoverished residents' lives, ozone in particular matter. Susan Johnson's going to talk to us under Community Health Day and give an update on the Charleston Heat Initiative. And I think all of that is going to be helping to try to make a difference in these communities. But it's going to be important as we collaborate with our transportation and CARTA and all, that we establish fast track routes for residents, reducing the need for gas-powered cars, improving accessibility to and from healthcare appointments. Again, look at the transportation. If you look at what's going on with preventive services for our age 65 and up, you see it in the 3 healthiest zip codes. The numbers are a lot easier for people getting to the healthcare where it is, but we can't take our eye off of it for this age group, because it's crucial to talk with community health doctors and other groups to run one-stop shop fairs or other things to get residents paired with providers to establish 65 plus preventive care. And I know that Dr. Richardson's also going to share to us about the new health department that's coming up right down the street in North Charleston, where they're consolidating services. So all those things will help tie us together to start looking at these a little bit closer. And with that, I'm going to turn it over to Joey to jump in here.
Much for that, and the data, is pretty clear about where we want to enact change. Right, we can see the areas time and time again, no matter which health outcome you're looking at, where we see worse health outcomes for folks in those zip codes, and specifically, we've even gotten census tract. So that's a good start. We now know kind of where we want to focus our efforts. But then the next question is, okay, so what are the leading causes of premature death, which is a direct indicator of life expectancy? And if we look at South Carolina in 2020, we see the leading indicators for premature death really fall into some pretty these main categories. We look at things, we see things like unintentional injury, which largely is made up of things like traffic fatalities. We see several chronic diseases built in this list as well. We see cancer, we see infant mortality, which of course is a big one, pulling our life expectancy numbers average down. We also see gun violence and suicide. And I know that those gun violence and suicide have been issues we brought up with this group time and time again. So, to see that in the list means that, it's something that we need to be paying attention to. And as we think about things like chronic disease, these chronic diseases, well, what are the leading causes of those? Well, it's generally, diet, exercise, and access to affordable healthcare. I hope a pattern here where we see some of these same things coming up over and over again, and we're trying to help kind of determine what areas we want to focus on in our initiatives. Next slide, please.
Go ahead and start, Joey, and I'll get my things locked.
Okay. All right. Well, so in the next slide, I think one of the pitfalls that we run into sometimes is we generally think that health is almost entirely based on a person's individual behavior, the choices that they make. But that's actually not what the data shows. It's only about 40%, which is still a large number, and it's something to certainly be looking at. Programs that help with behavior change on an individual basis, that's important for us to be supporting and looking at. But we want to also take into consideration that the social and environmental factors and genetics and other things also play a factor. So we need to take a multi-tiered approach here, and we need to ask ourselves, in these zip codes where we see these worse health outcomes, what does the social environmental space look like? What does the environment that folks are living in, and what does it look like? What things can we improve on? Of course, healthcare is there too, but healthcare again is only 10%. So the factors that go into someone going to a hospital and receiving care only accounts for about 10% of those premature deaths. And so what we're hoping to do is, so life expectancy is our mission. That's what we're hoping to affect change in. But to do that, we need to look what's upstream, these upstream indicators, right? So we need to look at chronic disease, injury, smoking, right? So risk behaviors. And then hopefully we can enact some change through policy and some suggestions that we can make and some programs that we can support at the city level, which can help affect those living conditions, the social environments, and just the environments that folks live in. Next slide. So the reason we put this slide in is because, here about health and all policies, why is it so important? Well, it's because it is a framework that helps us think through how we want to tackle these issues. And the big tenets of health and all policies really should help us in how we organize ourselves and how we look at tackling these problems. And so we want to make sure we engage stakeholders. We have some of the smartest and experienced people in the health and wellness field on this call. So that's a really good thing. And we want to try to support kind of that intersectoral collaboration between partners. And we want to make sure we promote health, equity, sustainability, right? These are all components of kind of how we approach these issues. But ultimately, we want to create some structural or process change. And I think that the best way for us to do that is through considering the health and wellness of our citizens in every policy that gets passed. And so that's really the framework around this health and all policies approach. And that's why we've decided it's the best way for us to kind of organize our efforts here. So how do we establish where our priorities are? Well, certainly we can take a look at what the city planning group has already put into place that we help put into our city's comprehensive plan. So we know that the pieces of health and all policies that were put in there really kind of center around transportation, built environment, food access, and environmental health. And so what we're going to be looking for is areas where we can find those win-wins, where we can, embrace the collaborative nature of the different organizations, but we also want to look at what is most, what the cost and effectiveness and feasibility are of some of these policy changes or programs that we want to promote. And certainly there are some things that are outside of the city's jurisdiction. So, when we think about complete streets, there are some streets that are not controlled by the city. So we really need to be taking a look at, what can we get the biggest bang for our buck here, and where can we focus on those indicators that are most affect someone's life expectancy, and certainly want to focus on those leading causes of premature death. And so I've listed a few examples here of kind of areas where we could focus. But once again, here are the specific pieces of our comprehensive plan that we have already made a commitment to trying to focus on in the next 10 years as a city. And so you'll see those 3 buckets kind of built out there, and you can see the language that has been introduced there. So I think this is a point for us. I think that we know focus. I think we can get a general sense of what areas we want to focus on, and then really the work of our Health and All Policies subcommittee or at large is to start finding ways that we can introduce enough. It can be through policy, through regulations. It can be through promotion of programs, through funding. There's lots of strategies there. But I think as we look for those win-wins and we look for where it's feasible and where we can enact the most change in those zip codes that we've already identified, we're going to find some wins here. And I'm excited for us to dig in and start looking for those ways to improve people's health and wellness. All right, Paul, I'll kick it back over to you.
Well, thanks. I'm gonna send you out a document. The third little reference that I had is from USA LEAP. There's a neighborhood life expectancy project that Robert Woods Johnson Foundation did, and it sort of chronologizes what 5 or 6 communities in our community are working on the same type of items we're talking about today. And so I just want you to see that and look at it, and as we go through our process, we'll be leaning on those communities also to determine a little bit about what we can do with ours. And this is the map that I was supposed to do at the beginning, but so the 29405, 407 area is right in here, and that's I think 71 point, just around 71 age life expectancy. The 29405 was the area in the neck. Right below that is the 29403 area, section 15. And then down here is the east side, and that was section 9 in the 29403. So those are the 4 areas that we had pulled out to do our comparison today with. Are there any questions?
Thank you, Paul and Joey. A lot of information, great presentation. Thank you very much. Before we move on again, any questions that I may have missed? Well, thank you guys, appreciate it. Oh, Mayor Tecklenburg.
Yeah, I guess I'd just like to make a comment that I think that's pretty comprehensive, all the information that you pulled together and thinking about all these different aspects. I really appreciate that oversight. I did want to share, I just got back from a little mayor's design session in Boston with about 10 other mayors from around the country. And it was focused on design, some design project in your city that also related to equity issues and how to design things to make your city more equitable. And the project that I presented to them was our proposed improvements of the low line, which goes through a good bit of this area that we're referring to. And one of the benefits of having a quality facility there will be just getting people out to exercise and focus on those quality of life issues. But but what I wanted to share, that we weren't the only city that was looking at these life expectancy disparities. There were 2 or 3 other mayors that had various projects, and it's the same story, second and third verse, you know, low income, mostly folks of color, having this lower life expectancy. And so other mayors are dealing with this issue. So that's just an observation on, I guess Nick might be commenting in a minute about the food desert aspect. And I just wanted to share that I read an article about a month ago, and I hate to say I forget where, but it focused more on healthy choices and lifestyle than whether a grocery store was within a half mile or not. That there's, they had documented some study that showed that even having a grocery store nearby didn't really make the difference, that people still were making unhealthy choices in the foods they were buying and consuming, even though it was more convenient for them. They were still buying, you know, soda pop and sugary cereals or whatever. But so this study indicated it's not so much about having a grocery store there, but about those choices that are made. And I know we're delivering some healthy food to neighborhoods where there's a food desert, but it might just be something we talk about and focus a little more, because getting a grocery store to locate as lower North Charleston is seen can be a very difficult thing. And it might be easier to get good food to people on a neighborhood basis, but more importantly, to be really focusing on the education and the choices that are being made. Anyway, just a few observations. Thanks.
Yeah, thank you, Mr. Mayor. Appreciate that. And anyone else? Well, thanks again, Paul and Joey. Great job, great presentation, a lot of information, and thank you for your efforts on that. We're going to move on. I'm going to call on Dr. Katie Richardson for a community health update, please.
Thank you. I was remiss last month by not asking Tracy first for any updates on the city of Charleston specifically before I got started. So Tracy, what do you have for us today?
Good morning, everyone. Nothing really to report, just that we are, continue to monitor the situation and ready to make adjustments if we think it's needed. So.
Thank you, Tracy. So I don't want to spend as much time as I usually do on COVID today. I want to talk about a couple of other things, but I do want to mention that cases are up across South Carolina, including in Charleston. They're up about 44% from last month. Thankfully, deaths are still lower, but hospitalizations are starting to creep up. So just a few reminders, none of this is new, but we do continue to have free rapid antigen tests at all health departments. We do still recommend testing if you've been notified as a close contact or you are symptomatic. And rapid antigen tests are fine for that purpose. We are still recommending vaccines, the primary series for those who have not gotten that, a booster for those who have not yet gotten that booster, and the second booster for those at higher risk, either because of age or other medical conditions. Those are still, information about where those are available is still on our Vax Locator website, the DHEC website. And then finally, we do have more availability of the treatments for COVID. So really, we're working to try to get the word out that for those who qualify, so those who are at risk for more severe disease, The treatments do require a referral or a prescription from a provider, but those are available at many more locations than they were previously. And so really our message is for those who have been diagnosed with COVID, if you feel like you may be at higher risk, please get in touch with your provider. And if you don't have a provider, FEDER, we're lucky to have FEDER in our community that is able to prescribe and give Paxlovid to those in need there at their facility after an appointment. So that is a good option for those who are at more severe risk once they have been diagnosed. We continue to work on increasing our wastewater surveillance across the state and do hope to have more information about that on our website shortly. So I think I'll stop there with COVID at the moment. Happy to take any questions while I bring up a PowerPoint on our new Charleston County Health Department that will be opening later this year. So let's see if I can pull it up. Can someone let me know if you can see it? Great.
Yes, good.
Okay.
Yes.
So this is some good news for Charleston County and the city of Charleston, and that is that at the end of this year, we will be moving into the new Charleston County Social Services Hub. Let's see if I can get it to move. Oh, yeah, there it is. So that's the building. It is on Rivers Avenue at Rivers and McMillan, across from the old Navy Hospital. It should be done by, I think, August, September, and then we hope to move in later in the year. This is what it looks like as of the end of this month. And here you can see some of the specifics about the facility. I think not only is it exciting for us to have a new building and across the state, counties provide the space for DHEC to provide services, but so not only will we be in this facility, but we'll also be sharing this facility with a number of other services in our community. That includes DOTUS, DSS, DHHS, other Charleston County facilities, and then DHEC, including Vital Records, WIC, which is our Women, Infants, and Children Nutrition Program, and Children with Special Health Care Needs, which is sort of a case management program for children who have multiple medical needs. That's the first floor. The second floor has more of DOTUS and DSS, along with other DHEC services such as preventive health. So that's our family planning and sexually transmitted infection clinics, tuberculosis. We will have our pharmacy there. Disease intervention is our DIS that provide partner services for those diagnosed with HIV and syphilis, and go out and notify partners so they can be tested in a way that protects the privacy of the person with the infection. Our epidemiology program, which is really run our COVID surveillance, will also be in that building, along with public health preparedness and drug control. And so we are combining 5 different facilities across Charleston County. We will still have our Mount Pleasant Clinic out near the Isle of Palms connector, but all of our other facilities, this is the public health side, so the environmental affairs side will stay in the building on McMillan. Not the same building, a different building on McMillan on the Old Navy base. But all of public health, other than the Mount Pleasant Clinic, will move to this facility. And then these are just photos of what it's going to look like. But I'm excited about this prospect. I think it will be great for the city of Charleston, even though it is not officially in the city of Charleston. It is just north of the city limits. It is on the Low Country Rapid Transit line. It's near the transit hub there. It's not far north of, of much of sort of, the peninsula. And so we definitely hope that it will draw folks from across the city of Charleston, being close to Cosgrove Avenue also, and coming from West Ashley. And I'm happy taking questions about that as well, but we are looking forward to that and hope it will really serve as a hub for the community and be a place, sort of a one-stop shop for many folks. Even though it may be a trip to get there, we hope it will be worth their while. So I'm going to see if I can, let's see how I can quit sharing now. Let's see. Paul, I'm not sure where. That's something that you or I need to do, or maybe no one else needs to share anything, but I will look into that. Let me just finish so we can move on. The last thing I wanted to share about our Fast Track Cities community chats. On the Fast Track Cities initiative was signed by Mayor Tecklenburg several years ago, saying that the city of Charleston would work to end the HIV epidemic here in the city, in concert with cities around the world. And as an initiative within this, we will be presenting to the Mayor's Commission on Homelessness and Affordable Housing on May the 25th at 10 a.m. That commission, as many of you likely know, is composed of passionate community members nominated or appointed by the mayors of the city of Charleston, Somerville, North Charleston, and Mount Pleasant to work on issues around homelessness and housing. And we believe that there's a lot of synergy with HIV and homelessness. We know that there's much greater risk of HIV for those who do not have their basic needs met, such as secure housing. And so we will do that as a way of introducing the idea of having community chats across the Tri-County area to begin to address both of these sort of issues and how we work to improve the health of the homeless population, as well as how affordable housing will help to sort of meet that sort of Maslow's hierarchy in order for those who are in need of prevention services, whether that's treatment for IV drug use or unsafe behaviors, such as needing to trade sex for drugs, would help to decrease the risk for this population. So we look forward to that. Any of you who are interested in attending or being there, please let me know. And we appreciate Mayor Tecklenburg's assistance in the future in encouraging other mayors in the Tri-County area to work with us on bringing other cities into this initiative, knowing that this is an effort that obviously crosses city boundaries in our area. So that's what I wanted to share today, and I'm happy to take any questions.
Any questions at this time? Mayor Tecklenburg.
So I just want to share the, I guess excitement is a word, or enthusiasm about your new facility, Dr. Richardson. That's going to be a great asset for the community. And even though I understand it's just over the border, so to speak, we all know all these issues don't respect jurisdictional boundaries. And if you look at the life expectancy map, including the southern part of North Charleston, really that facility is right about in the heart of where the need is the greatest, just from that perspective. So that's terrific. And just going back to COVID update, I did want to share with everyone, just for the record, that since the legislature passed and the governor signed last week a new law prohibiting local government from having any kind of COVID vaccination mandates, that we have suspended our vaccination requirements in the city of Charleston. We really dialed it all back down to just the remaining requirement was that for new employees, we had a requirement for a vaccination, but we can no longer do that. So we've suspended that policy as of last week in compliance with the new state law. And I just thought I'd let y'all know for the record. Thanks.
Thank you, Mr. Mayor. Appreciate that. Any other questions? Well, thank you, Dr. Richardson. We appreciate that. And if we could, I want to call on Dr. Susan Johnson for our heat updates. If you feel like you'd want to still present that, Dr. Johnson.
Yeah. Can y'all see my screen? Yes.
Yes, I can see it.
Let me see if I can.
Yes, we can see it.
Great. All right, well, I'll try and breeze through these slides because I know we don't have a whole lot of time, but it's a really great tie-in to the presentation that Paul and Joey shared and ties into the health and all policies work. So I have presented to this group on multiple occasions some of the work that we are doing around heat health. And so this first slide, I think, is really important to just share with you the scope and diversity of our partners. So we've got researchers from all the major research institutions in North and South Carolina, as well as many municipal and community partners. This slide, I think, really does a great job of really identifying the dangers of extreme heat. And, we focus so much in Charleston on water, but we want to change the dialogue to water and heat, because these are both impacts to public health that are being exacerbated by climate change and that we need to address in terms of protecting vulnerable populations. And, this slide, anyone is vulnerable to some of these impacts, but some more than others. And that's where we really want to look at kind of those social determinants of health, occupations, and folks who are more at risk for experiencing these. And then this kind of really ties that in. So how are all of these interrelated? So the climate, we know that vulnerable populations are more susceptible to the negative impacts of climate change. And then they typically have, underlying health disparities as a result of their living conditions and ultimately are more susceptible to negative health outcomes as a result. So some of the things that we've been looking at and what I have been presenting and talking to with this group, obviously are nature-based solutions, and then some more structural built environment solutions. So this just kind of captures the fact that we do live in an urban heat island, and we've been doing, kind of focusing some of our research on what that looks like in terms of materials, wind, building structures, concrete, ground cover, and tree planting. And then correlating that with where folks are living and where those vulnerable populations are. So these are some of the focus research questions that our team has been looking at. And these, again, are our collaborators. Last year, we engaged in two separate research studies, and we used these different measures of heat stress. So the heat index, which people are most familiar with, which is air temperature and humidity, but then also being able to capture additional data that is very relevant as we look at the built environment around wind speed and solar radiation, and how we can implement some mitigation strategies to address those concerns. So we participated in, as I said, two research studies. One was specifically related to a workforce that are typically outdoors. So we looked at our MUSC grounds and public safety, and as well the Citadel public safety and grounds. And then the one that this group has been mostly involved with was the Charleston Heat Watch. So we applied to be a part of the Kappa Heat Watch last year, and we were accepted. And so we captured data on July 31st across Charleston. And these were the organizations that were involved. I know I was recruiting from this group. So if you help to support that citizen science, we really appreciate it. So we, just kind of high level, some of the preliminary results. What we feel like is most important for taking this data and combining it with a lot of the things that we've talked about today is to identify areas where we could actually have an impact. Some of the things that we've been doing is just raising awareness. So writing some op-eds in the Post and Courier. They've been doing a great job of covering our work. And then, kind of just what is our plan for this data? So some of the things that we have in the works, we were able to, thanks to the Health and All Policies group and the support of the city and city council, we're able to add extreme heat as part of the comprehensive plan. I've had conversations with the head of the Tourist Bureau, and they are looking at donating some funds. I've had conversations with Jason Kronsberg to put in some hydration stations along common tourist routes, which we think will be great. We are looking to develop a heat advisory system so we can alert our community members, similar to what we do with the horse carriage, the horses. When it gets too hot, they are not running. We want to also consider outdoor workers and other vulnerable populations. And then most relevant to the presentation earlier at our meeting is I'm really excited to share that we've convened a group to look at a pilot project in a public housing public housing neighborhood. So this would combine some of our existing partners, and this really came about because we have been partnering with Power Plant SC. Duke Energy donated a lot of money for tree giveaways, and we had a conversation earlier this year and felt like we really wanted to be more strategic about our involvement. And so the Power Plant group, as I'm on the planning committee, has agreed to work with us and donate whatever species and size of trees we need for this pilot project when we're ready. And so we have looked at the heat research and identified areas on the peninsula that are kind of the hottest and then most vulnerable. So we have an amazing team. We actually met yesterday, and I'm just going to quickly share with you who is on this team. So Dale Morris, our Chief Resilience Officer from the city, also from the city, Casey Conrad, Robert Hauk, Kaylin Cazella, and Katie McLean. From the Citadel, we have Scott Curtis, and from MUSC, myself, Dr. Jerry Reeves, and Christine von Kolnitz. So and then we also have Janice Barnes, who is facilitating. And we believe that we have access to some funding from NOAA to support a pilot project. So what we did was Casey Conrad did a great job of taking all of the different data sources that he has and overlaid the heat, the tree canopy, ground cover, and then the zip codes. And we landed yesterday on Gadsden Green, which is in the 29403 zip code. And we think that there were 3 that rose to the top, and that one really seems to be the most viable in terms of impact. So we'll be, Dale Morris and Janice Barnes have a meeting with NOAA next week to get a little bit more clarification on the funding. And then we will be reaching out to the Housing Authority, obviously need to get their buy-in. And then we will be coming up with kind of a menu of mitigation options, tree planting being a big piece of that, but we have a lot of other ideas as well. And we really want to engage the community and the folks, the residents who live there, to see what they feel like would benefit them. And I think this could just be the start of something really exciting. We'll be working with one of our researchers from MUSC, John Pierce. He's been working with the Low Country Alliance model community in Rosemont, and there are just a lot of options. Of course, MUSC has a presence at West Edge. I think that a lot of the things that we discussed and that Joey highlighted as potential areas of focus for this team, we could include. So I'm just really excited to share that.
Thank you, Dr. Johnson. Any questions? All right. Well, thank you very much for that presentation. You can see in the chat that Maggie had left a message. She apologizes for having to leave. They had a staff meeting today at 10, and they continue to offer COVID testing and distributed at-home test kits to staff and offer at-home test kits to students for parents to come pick up. In their April 25th update to the board, they had about 17 staff cases and 32 cases district-wide, which remains significantly below where they were at the start of the year. They'll continue to monitor rates and trends overall within the schools. Graduations will be taking place June 2nd through 4th in the North Charleston Coliseum and the Performing Arts Center. And they're looking forward to celebrating their 2020 graduates. And she wishes everyone to have a great week. So, so thank you to Maggie. We certainly appreciate what you do for Charleston County Schools and our constituents in the city. So, anyone else have anything on community updates before we adjourn? Dr. Johnson.
All right. So I would like to invite everyone to come out to MUSC on Friday at noon. We are partnering with Mayor Tecklenburg and Councilman Seekings and the city on the new bike share launch. So super excited. Let me just pull up my press advisory. So it will be the e-bike sharing program launch, and we'll also be hosting a First Ride Academy, which is a safe riding training course. And the press conference starts at noon next to the Urban Farm, and we'll be doing some helmet giveaways. We're also doing this as part of our Nurse Appreciation Week, and that Friday is our wellness day for our nurses. So we'll have lots of activities planned, but if you do come out and you see a nurse, please thank them for their service as well. And then I think I had some other things, but I can wait. Actually, one other thing, the Healthy Business Challenge. We have our first in a series of site visits planned at Mount Pleasant Waterworks on May 25th. They, during COVID, built an amazing outdoor fitness facility on their campus. So they have just been super engaged with the Healthy Business Challenge since its inception and do a great job engaging with the community. So they're going to be sharing about all their great work, and then they're going to take us on a tour of their facility. So we will send out that invite to everyone as soon as we have that up. We hope that you'll register. We have to cap it at 60 just so we have enough So we're not overrunning our partners there, but would love to have you join us.
All right, thank you very much.
Dr. Johnson, what time is that event on Friday? Thank
Noon.
you.
It is at noon, and if you need parking, I believe we have the parking garage at B and President Street. Just let them know when you pull in that you're there for the press conference.
All right, thank you. Jennifer
Thank you.
Roberts.
Yeah, I just had a quick one thing to share. May is Mental Health Month, everyone. And as we have probably for past 8 years, we will be doing an Art of Discovery show at the Circular Church during Piccola Spoleto from May 27th through June 12th. It'll be open from 11 to 7 every day. This year we are featuring kids art again from schools from all around Charleston, Berkeley, Horry County, Beaufort County. And we're having a reception on the Saturday, I think it's May 28th from 4 to 6. Please stop by anytime in those 2 weeks and see the art. Last year, it was amazing. You would have never known it wasn't all adults doing it. It was just amazing. So please join us and help spread the word about Mental Health Month. Thanks.
Very good. Thank you so much. Anyone else? Well, Nick Osborne.
Yeah, no, thanks ever so much. Just to say that we're gearing up for the National Association of Letter Carriers Stamp Out Hunger Food Drive. I mean, this is a national event that's taking place. I think it's the first time it's taken place since 2019. So this is, as I said, taking place across the nation. So this is anyone can leave non-perishable food items out by their mailboxes. They'll be picked up by the mailman and they will be collected at all the post offices. So we're working with all the post offices across here in the Tri-County to work to collect that food, and then we'll be distributing that out. I think historically we've been able to collect anywhere in excess of 100,000 pounds of food. So it's an important event and something that again will benefit quite a lot those communities that need food. So that's 14th of May. So just wanted to raise attention to that.
Great. Thank you, Nick. Great work. Appreciate all that you do. Thank you so much. Anyone else? Well, just want to tell you, thank you so much. A lot of great information, good meeting. And, you know, I know your time's valuable and we appreciate you giving time. It certainly helps us at the city. So and appreciate all your expertise. So if there's nothing else, I will call this meeting adjourned. Thank you so much.
Thanks, everybody.
Thank you.
Thank you.